Good afternoon and welcome to TechNation's Tools of the Trade live demo. Today we'll learn more about the tool of the trade, FSI's capital planning and analytics tools, which is also featured in the June issue of TechNation magazine. We're joined by Joe Stockman, Director of Product Experience at FSI, and Justin Ryan, Product Owner, CMS Analytics at Enstoa. And they will be exploring how to use tools within FSI's CMMS to evaluate department performance metrics, develop and communicate for future plans, and monitor progress over time. So thank you to our sponsor, FSI. It's a healthcare CMMS EAM provider. So to learn more about their platform, please visit fsiservices.com. Okay, today's webinar, as usual, is eligible for 1 CE credit from the ACI, and you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. Now, just a quick reminder to please join us for our HTM Mixer being held at the Hyatt Regency in Milwaukee, Wisconsin from July the 31st and August the 1st. Now, our mixers are a slightly modified, smaller, shorter duration and less crowded event, but still provide valuable continuing education, networking and vendor engagement opportunities. So for more information and registration details, please visit htmmixer.com. Also, please save the date for our fall MD Expo, which will be held at the Renaissance Dallas Addison Hotel in Dallas, Texas, from November the 10th to the 12th. Join us for 3 days of education, networking, and the latest advances in medical technology products and services. So for more information and registration details, please visit mdexposhow.com. Okay, let's kick off today's demonstration by giving away a Swissforce Meister multi-tool. So using the questions feature on your dashboard, let me know the answer to the following trivia question. Today is National Cheese Day. So which state is known as the cheese state? I'll reveal the answer and our winner at the end of the webinar. We'll be wrapping up today's presentation with a live Q&A, so please submit your questions anytime using the questions feature on the webinar dashboard. Now, as I mentioned earlier, our presenters are Joe Stockman and Justin Ryan. So, Joe, you may begin whenever you're ready.
All right, thank you so much. All right, thanks everyone for joining. Today we're, for the Tools of the Trade webinar, we're gonna be talking about strategic analysis and planning for HTM departments. Let me get mine. So we're gonna first start off with just introductions. Justin and myself will give you a little bit formal introductions. We're going to talk about why do we evaluate historical data, and then how that applies to a couple of different areas. One is capital planning and justifying replacements, and two is just general analytics into how your department is running. We'll do a little bit of a discussion on sort of what's next, as the future holds, so to speak, and then at the end we'll have times for questions and answers. So a little bit about myself. I'm Joe Stockman, Director of Product Experience here at FSI. I've been with FSI 22 years and been in the healthcare CMMS world for over 30 years. So it flies by. And my role here is basically working with customers to understand what their problems are, help them solve those problems with software, creating new efficiencies in the CMMS or in our analytics tools on both the HTM side and the facilities management side. So we do both here at FSI, but today we're focusing mostly on the HTM world. And Justin, do you want to talk a little bit about yourself?
Yeah, sure. Thanks, Joe. So my name is Justin Ryan. Like mentioned, I'm the product owner of CMS Analytics at Enstoa, and we partner with FSI on some of these analytics tools for CMMS. And I've been working with both of these companies for coming up on 6 years and 5 years of very specific tailored work to CMMS analytics applications. And the main focus of my work right now is just helping get healthcare facilities from, a position of doing work and operationally just getting things done to a position of really understanding the work that you're doing so that you can improve on those results, whether it's analytics or, other engineering efforts.
All right, thanks. You could tell those are the most recent photos of us as well, so perfect. So why do we evaluate historical data? Let's do a little bit of a discussion before we get into the demos. One is, just resource optimization and budget justification. You really want to understand, how your equipment's operating. So you're looking for trends in equipment failure, looking at the frequencies you're performing those types of maintenance activities, PM activities or inspection testing and maintenance activities, sometimes called ITM, looking at downtime of equipment. So you really use those that history of that equipment to learn how to allocate your resources more efficiently and justify potentially hiring more people if you need to, or I'm sure everyone doesn't have too many people, so that's usually the case when trying to use the analytics tools. But really, what is the departmental needs? What do you need to do? What types of skill sets do you have? Do you need to train people? Are some people taking longer than others to do those types of equipment? Is the equipment old or outdated, or you're doing lots of repairs on it? Your CMMS is sort of the backbone and the source of truth for all that information. So that should be where you're tracking all this information within your CMMS and in your department. So the asset lifecycle management, you really want to look at the historical data to make sure the equipment's functioning. We're all here for the primary reason of patient safety. It always comes back to patient safety. So you're working on the equipment. So the nurse or a person hooking that piece of equipment up to a person knows and is confident in the fact that that's going to work and that's going to keep that patient healthy or alive. So that's why we do what we do. It's a noble cause. I like to say we support the front line. So we're sort of the ones behind the scenes, and that's what we say when we say healthcare service professionals. But as equipment gets more complicated, as there's more and more computers and more security risks as well, how do you identify what's getting near the end of life? What can't you get parts for anymore? What's out of service or what was bought by another company? As companies merge and become one, GE seems to gobble up a lot of them, and there's equipment out there that has a name of something else, but you actually go to GE to get parts. So how do you track all that? How do you see all that type of stuff? And how do you know the history of those items? And like I said, that means you could plan, and that's the basis of all this historical data. Without the historical data, you can't plan for replacements, or you can't forecast what you need for the future. Also with risk, looking at incidents. So when you're looking at a piece of equipment, potentially when you're setting up, an AEM program, an alternative equipment maintenance program, or something along those lines for your HTM department, if equipment fails often and you're tracking that, you might not want to put that in that type of program, or you might want to look at what could be used for an AEM program if there aren't any incidents, sorry about that, for that particular device type or new device. So when you really understand, what equipment functions properly, mostly what ones you have problems with, what maker models you have problems with, you could plan for replacements of those as long as you're capturing those in your CMMS. And that's what we're going to take a little bit of a look into the CMMS now, and specifically on capital planning. So capital planning basically is just getting dollars or getting funds, from your hospital, your organization, on what you need to operate your department effectively. So you want to stay on track with your budget goals. You're going to have some type of target budget, whether it's loosely based on last year's budget. If you sort of have an idea of where your budget's going to be and how you're going to spend against that budget. But how do you know what you need to replace or what you need to buy? That's part of what's in the CMMS. So, as long as you're tracking certain types of data, and we'll show you that data in the CMMS, sort of what those things are, you're going to be able to do a deep dive into what that equipment is and let the CMMS help you make those decisions rather than just working from a blank slate or an Excel spreadsheet, which we see a lot of departments doing that don't have a mature CMMS program. So I'm going to go swing into the capital planning demo, and we're going to show you FSI's CMMS. It's called CMS, and this is what it looks like. So this is what it looks like when you log in. This is our customizable dashboard that sort of shows, an overview of the department. But we're specifically going to focus on assets. I'm going to click into the assets module of our CMS program. And what I'm looking at here is a list of assets that have a replacement associated with it. So you can see here, we just have a list of assets. We have some anesthesia machines. If I scroll down the list, I have other devices, mobile C-arms, portable X-rays, different types of things in here. And, going across, the columns over here on the right, I have the installation date, when this was purchased or when this was put into effect. I have my anticipated replacement date, which is calculated from the life remaining. So, all this equipment has a expected lifespan, and that's calculated automatically by the CMMS to show when it's there. You can see some of these are already past their date. We have a lot of equipment here that is past its useful life, so to speak. And most equipment does go past that. It's very rarely that you have the funds and the dollars to replace those, when they're supposed to be replaced. That's not something you can do, especially, think on the facility side, all the air handlers are installed as soon as that hospital's built, and they have a lifespan of 20 or 25 years. They're not at the 25-year mark. Okay, time to replace all of our air handling units. That's not how that works. So you use other data to sort of anticipate and make decisions on what to replace. We're also tracking things like replacement costs. These are, what it would cost today to replace that piece of equipment. We have a lot set here at $35,000. Sometimes there's some installation costs, maybe for an MRI machine or something along those lines, where you might have to take a wall out or something along those lines, or get for an MRI chiller to get a helicopter or something to put that on the roof. So there could be some additional costs, and just for the cost of the equipment itself, that's all dependent on your particular installation of that type of equipment. So when I look at one of these pieces of equipment, I'm going to go ahead and pull up one of these anesthesia machines. And this is why I talk about the history of that equipment. So I'm going to pull this up in the CMMS. We do have all that data stored, in the records for things like the life expectancy of this is 10 years. That's why it has its anticipated end of service life at the end of 2024. We're 1.3 years past that. This is where we can adjust and fill in that replacement cost. We do track the last time that was updated as well. So if it was updated, if that replacement cost was last updated in 2020, we know that cost probably needs to be looked into and modified as well. We also track the condition. If there is newer technology, we have a condition here called replacement budget, newer technology required. I would recommend, tracking condition of equipment, making this part of your annual PM inspections where the technician could assess that. Your biomed techs or your BMETs can go in and say, hey, this is still in good condition, even though it's 10 years old, or I can't find parts for this anymore. We really need to look at replacing these. These are things that if you're tracking this within your CMMS, again, it makes it easier to make your case for getting replacements for that type of equipment. So this condition field becomes a key field in looking at that equipment. The other aspect of the CMMS, I'm not going to go through the entire screen here, but we also track asset downtime, how often that piece of equipment was down. But the key is the work order history. Am I doing a lot of PM work on this? Did I increase my frequency because it breaks a lot? Are there a lot of corrective work orders or break fix work orders or service requests, whatever you call them? Are there a lot of those? You can see this has a couple of corrective work orders. Staff reported that the bag arm looks like it's about to fall off. If you're tracking that information and capturing the asset as part of that work order history, we have a feature in the CMS capital planning module that actually looks at the equipment with the most number of corrective work orders and identifies those regardless of age. It could be a new piece of equipment that has a lot of work orders. It could be a 30-year-old piece of equipment that has a lot of work orders. So we don't look at time when we look at those. So everything's based on, first of all, having a great asset inventory and then having these fields filled in for the asset inventory. So what that ties into, I'm going to switch over to our capital planning module. So I'm going to click on the capital planning menu over here on the left, and that's going to load our menu or our capital planning module. And I have a 2026 capital plan pre-built. I didn't want to go through the whole process of showing you, from step by step how to build that. But basically, we have a budget set at $10 million. We have some things identified as replacements of $3.5 million worth of replacements, some additional purchases of what we might be purchasing. We'll talk about that in a little bit. And then we have our current total and then how much is remaining. So we sort of visualize sort of what we need for each of those types of equipment. This maintenance budget by asset category, this is something maybe we're looking at purchasing. So if we're looking at purchasing a new MRI machine, seems like a steal at $3 million. I'm not sure what those cost. Some chemistry related items, some CT PET scanners, and maybe we want to get some iPads for the department so we can go do our work mobily in the field. So we added tablet computers into there. And then we have a visualization over here on the right that sort of shows like a little thermometer. It's sideways, but it's, as you approach your budget or as you go over your budget, this black bar is sort of where we are. That's the $9.5 million mark. As we get closer or go over the max, you'll see it go into the red there as you look at the visualization. Just two graphs in the middle, a breakdown of where our replacement costs are in the red, where our maintenance costs are. These are our new purchases, and green is the remaining. That's how much money I have left to spend. And then that maintenance breakdown is over here. Those 4 pieces of equipment, or types of equipment, I should say, at the top is sort of what's represented over here on the right graph, where I have the MRI machine, the PET scanners, the tablet computers, and the other. Notice how small of a chunk that tablet computer, $25,000 of a tablet computers is on that pie chart. So it gives you relative cost into those things. But the main thing, within is what we do in the CMS is these assets to replace. This is at the bottom. And we have this function, it's called the add assets for replacement consideration. And this is the part that does the analysis automatically within the CMMS. So across the top of the screen, we have three tabs. They're the modern version of tabs from the old Windows interface, but we have assets near expiration, and that shows us all the assets that have that end of service life coming up in that fiscal year. So if we're building a 2026 plan, it's going to be 2026 and earlier. If we're building a plan for 2028 or 2029, it's going to show me everything 2028 or 2029 or earlier. So it does know when that end of service life is. It doesn't just show me everything in 2026 because there are some things, like you said, that go past their useful life. We've been maintaining them very well. It's like an old car. You could have a 1960 car that runs great, or a 1960 car that is sitting in your garage and won't start at all. So it depends on how much you take care of it and how much you do those types of things. So in this list, you can see this is all the equipment, and we have a lot of equipment here, 3,800 or so items in here that really are near the end of useful life. And we show some particular fields. One of these fields that we show here is this condition assessment field. If we wanted to narrow that down to everything that could potentially be replaced, maybe I just pick my 5s replacement budget and my 7s, and now I just narrowed that list down to a much smaller list of 28 items where I have them marked as conditions. So if I'm doing that on a regular basis and marking the conditions and letting those things know, I don't have to go through 4,000 pieces of equipment to see what needs replaced. I might be able to prioritize these right away and check these, like, hey, these all I have marked for replacement, so let me go ahead and add these to my list. I'm going to go ahead and select them all and add those onto my list. So, and as I select them, they do show up in this bottom part, assets being added. So again, with the end of service life, the condition, that's one area where we can definitely look at how to add these in. Now, the nice thing about the next tab, this is our high repair assets. And what this shows us, there are all the assets in the system. We have this one administrative assets that we have this particular sample where everyone puts this, if there's no asset on it, so that one kind of, there's not a piece of equipment that has 1,000 repair assets on it. That's just a general pool for that. Some people use that type of thing if you require an asset on every work order. But you can see there's certain types of devices like some safety analyzers, that have 62 unscheduled work orders associated with them. We're also showing that some of them have the life expectancy. They're near their end of life. So we can select those as well to add those for the consideration as well. We could also look at the conditions. This only shows the ones that are available. So this one shows that, there's a couple in poor position. I could filter that down if I had a lot more on this list to show certain types of data as well. But typically, in the scenario, when we were building this module out, we found that a lot of customers were using Excel. They had their sort of list of assets in Excel, and they were going back and literally running a query on each asset to say, hey, how many corrective work orders we have on this asset and this asset and this asset. and doing that on a manual basis where we just took all that information, since it's built into the CMMS, we're able to just get that information right in front of you. We could see every piece of equipment and how many corrective work orders it has. We're also able to analyze how many PMs we're doing on it. So if you did increase the frequency of a piece of equipment, that's something else we could look at as well. And finally, we just have the section called all assets. If we want to just filter by this, those were the ones due for replacement, but maybe we have some newer equipment that's set for replacement budget as well. We could select those. We could select everything, maybe some of the older equipment. We have some stuff going back to 2002, 3, and 4. Those are the ones we want to replace. So if we wanted to go ahead and pull everything 2010 and prior that has a replacement budget, we can do that. So this is more of a filter on all of the assets in the CMMS, where I could filter on all those fields to kind of pull those up. So we have 3 different areas. 2 of those really tell you, this is the analysis portion of the CMS program to say, hey, here's what's going to expire, and here's my high repair assets. Once I get those selected, I could save and add those to the list, and that populates my list down below. And this list down below is sort of what you're using to drive what you're selecting to replace. So if you're looking at this list, and I have some things up here, I'm at 9.5 million. I did add some new things to the list potentially. So let me increase my page size here so I could scroll down. So if I select this item at 50,000, or if I go ahead and select them all, let me just unselect them and select them all. You can see now I'm at a lot higher of a value here. I'm not too much higher because the stuff I added wasn't very big, but now I'm at 9.6 million instead of 9.5 million. My remainder's down to 355. So some of those pieces of equipment I added were in the $40,000 to $50,000 range. So once I deselected and selected them all, that adjusted my number. But if I go ahead and let's just say this scanner, I unselect that, you can see my remaining now went to 2.8 million. So it's kind of interactive. As I select, high value equipment or deselect that high value equipment, my graphs change in real time. And again, going back to the model of what people are doing, they're typically, again, they have all these in Excel, they're holding the control key down, they're clicking on the total, and then they're looking at the little total in the bottom right corner of Excel that says, hey, I'm at 9.5 million, I'm at 9.6 million, and what if I add this one in? So again, this just gives you a tool to build that out, and you could save this scenario. Within the capital planning module, you can maybe make scenario 1, scenario 2. Right now, I just have it set as sort of the capital plan, but I could have capital plan V1, capital plan V2, where I have different items selected in the list. And this is what I'm using to actually build out the tool. So when I'm looking at this, I can look at analysis of individual equipment. So if I want to look at this scanner, I could pull up some data on this. I'm looking at the cumulative, I have unscheduled work and scheduled work. So with my unscheduled work, I'm looking for a particular period of time that this is the amount of money, time and materials, what I'm spending on a piece of equipment. So as you can see here, my total cost is in blue, my material cost is here in red, and my labor cost is here in green. So this is over a 5-year period, and you could set that range, how far back you want to analyze that, and look at my unscheduled work. And then I can look at my total cost, when am I spending money on these things? So again, it gives you an idea of how much you're spending on this piece of equipment. If over 5 years I spent $7,000 and it's a $30,000 more, or if I see myself spending more, if I see that keep going up and the cumulative cost over 5 years keeps climbing, or I see the curve going the opposite way, that might help me make a decision of, do I need to include this in the capital plan or not include this in the capital plan? And by the way, I could do that same thing on the scheduled work as well. It's a little bit more steady because we're doing annual maintenance or semi-annual maintenance or quarterly maintenance on these things. So I'm spending time on labor and materials. Maybe there's always parts I need to replace. Maybe sometimes there's parts I need to replace on demand. I can see if that's increasing or decreasing again. And this is at the asset level. And again, this is all based on the historical data within the CMMS. So again, very important to have that information in here. And it gives me the cost breakdown and the category breakdown. And finally, when all this is done, this column list is customizable. I'm able to go ahead and set this. The idea is this is going to help me build what I'm sending to my finance department. This isn't designed as a tool for your hospital's capital planning. This is designed as your department's tool to make the case for the data where you can go ahead and present that to that team. And it's typically a spreadsheet that you're sending over with some maybe anecdotal data, but that's sort of a quick overview of the capital planning module in CMS. So let me transition back to the slideshow here, and we're going to go on to the next slide. And we're going to talk about analytics. I'm going to pass it over to Justin.
Cool. Thank you, Joe. So a lot of the things that I want to kind of discuss today about analytics are actually not too different to a lot of the things that Joe showed in terms of, being able to visualize live changes and see how, your breakdowns of budgets change if you add these particular assets or change these or change that. The main goal of analytics from the perspective that I'm going to be talking about it, though, is that first bullet point here is that it's more looking at system-wide benchmarking and optimization at scale. So it's taking a step back from those kind of views that we were just looking at, where instead of looking at one particular asset and understanding its life cycle, you're more looking at, how much time are we spending across our system as a whole on what assets are we spending our time on? How are we, how much of that's proactive? How much of it's reactive? How much of that are things that are planned? Do we have them planned correctly? Those kind of things, but from a much, I'd say, higher level view. And so the goals in doing that is to, be able to apply data-driven insights so that then you can, beyond the scope of capital planning, or maybe even assisting in that scope of capital planning, make decisions and change policies or change programs and improve the way that you're doing things at your facilities and within your HTM departments in an informed way. And the kind of third tangential piece to that is just making sure that the work that you're doing, you have trackable ways and provable ways to say that, we are inspecting and testing and maintaining our assets in ways that are compliant. So we know that when the regulatory agencies show up, we know that we are good. We'll be able to provide them the data that they need. And we know that well in advance because we're able to identify when things are kind of getting out of line. If you could go to the next slide, Joe. And so how do we do that? Well, we start with a core goal, and the goal is to just make it so that the data that we're producing in our CMMS is easy to access and it's understandable. And Joe mentioned something earlier about centralizing your processes all in one CMMS, and that is very, very key, because when we get into things like our strategy, we want to plan out our data strategy, collect our data in something like a CMMS tool. We want to model that data and we want to deliver it. And all of these steps become much more robust and much more easy to implement when you're looking at something that is a single source of truth, like a wide-ranging CMMS tool. And then from there, you want to find ways to constantly improve that analytics, to improve the kind of questions that you can ask and the kind of answers that you can find. And the way that we do that at Enstoa and FSI is we work with healthcare leaders that are the customers that we work with all the time, and prospective customers. And though they lean on each other through things like the cohorts that we host. So those are where they say, we want to ask these kind of questions, and right now we're struggling to ask them. They have things like the neighborhood, where that's kind of almost like social media, but for healthcare management. And that's where they can say, hey, we're doing XYZ and we want to try to improve on this. How are you doing it? What are your thoughts on this? Or we think this new feature would be nice. Does anyone else want to chime in? And we kind of collect that data to make sure that we're constantly kind of improving your ability to do these analyses and make these changes to improve the processes that you're doing. And at a high level, sorry, I paused for a second just because I was kind of catching my breath. But if you could go back just for 1 second, Joe. When I talk about that planning, collecting, modeling, and delivering, so that typically looks like a CMMS tool. We store that somewhere. That might be a data warehouse or data lakes, depending on how you want to handle all that. That all gets brought into what we call a modeling layer, and that's where we just kind of prepare data for those kind of analyses at scale. So if you're just running an Excel workbook with 2.5 million rows, good luck. Like it's going to be tedious, it's going to be slow, it's going to be error prone. A lot of these things, when they're stored in these kind of tools that are designed to store them and modeled in ways that make them more efficient, then it allows us to kind of implement these reports and make them so that they're very interactive, they're very fast, they're very responsive, and they're also very reliable. And now, Joe, if you don't mind skipping.
Right. So we're going to pass this over to Justin. Justin's going to do the demo from his machine. So give us 1 second here.
Excellent. So I'm going to take over this screen share. And so the screen that I'm going to kind of land on here is what we call a status board. And so this is actually not going to look all that different to something you might see in a transactional system, like a CMMS system, where you're generating work orders and you just want to look at, what's your queue, kind of what's your current status of work that you have to be done. And this is what I like to call the kind of first domain of visualization analytics, and that's just operational data. So this isn't for trend, it's not for analyses, it's just you land here. These are your kind of oldest work orders. This is how many work orders you have that are overdue on particular assets. If you want to break that down, maybe we only want to see the HTM data, then we can, break this down to what's called a segment in CMS and view this only from the perspective of those HTM segments. And we can see that, there's 19 work orders that have been generated that aren't yet assigned to anyone. They're in kind of a waiting dispatch queue. 35 are being worked on. 39 are, not overdue because they're not needed, but they're very, very old. Maybe they fall into the cracks. And roughly 10K of these work orders in our kind of theoretical facility are currently overdue. So they have needed by dates and they're late. The oldest of which in the system is from 2018. And kind of quickly you can see maybe that's actually work that work order just needs to be canceled. Maybe it is really 7 years overdue, or maybe that's just something you need to clean out of your system. That's not really what I want to focus on though. What I want to focus on is more jumping to the kind of two other domains. And the second of those domains is trend analysis and optimization. But before you can get into those things, you need to be able to kind of trust that the data that you're producing makes sense. And the way that we do that is with more kind of data quality focused reports. And those come through things like what we have as the ITM program reliability report. And this report's all just around, what assets do you have? How many do you have tagged? Are they scheduled, and are they scheduled correctly? So what kind of regular preventative maintenance are you doing on those work orders? So this helps you just understand that, if I look at the system, if I focus this down to our kind of HTM segment, I can see that there's all these different assets on the right side that, when I'm looking at wound therapy systems, of those 700 assets, 475 of those do have schedules. It looks like those frequency on those schedules when I hover over them range from anywhere from 3 months to a year. But there's 222 assets in our system that are of the same type of asset and they're not scheduled. And there can be cases where that's intentional. Maybe you don't actually need to be doing any kind of preventative maintenance or inspection on those assets. Maybe you can tag those assets with their own risk classification saying maintenance not required or what have you. That way you can easily filter them out. Or maybe they are just not scheduled, and that's not necessarily going to show up in your system because there's no magical identifier that's going to say, hey, you missed a PM that didn't exist. But through things like this, you can see that those aren't going to be generating work orders for your technicians to do at the moment. And then if we wanted to, we could kind of filter this down. Maybe I want to only look at my high risk AEM assets, and I can kind of quickly see that a lot more of these are scheduled. So out of all the assets we have in this facility, only 17 of them are actually missing schedules, and they're under these asset categories, and so on and so forth. And I can do that for my other high risk assets. If I wanted to, I could include all the high risk. And this is just a very simple way to just make sure that things are scheduled correctly, or that they are scheduled just at all. And then if you want to kind of take a step deeper, the way that most of our reports and our kind of design philosophy stands is that we start with higher levels, and then you take it as deep as you need to take it for whatever questions you're asking. And so when we go into the details, it's just a little bit more information about, for this asset category, what kind of inspections are we doing? How frequently are we doing them? Does that change between the different facilities that we might have? And right now I only have this filtered to Pittsburgh HTM, but if you might have these kind of segments broken down into multiple hospitals across your system. If you're a multi-hospital system, and you might see that at one facility you're doing this every 6 months, but at another facility you're getting by with them doing it every year. And those can be the kind of things where, if you don't have to do it every 6 months, then maybe you're doing kind of redundant or unnecessary labor. You can also kind of look at this and see, for things like this C-arm quarterly, in our demo data, we have, some quarterly assets. There are 3 of these that are in fact scheduled to run every quarter, but there are also a lot of these other assets that have frequencies on them that, this is also running yearly. There's another one set up to run every 12 months. There's one set up for 4 months, one to run for 6 months. And for all of these, if they're only scheduled to do this inspection every 6 months, then you may not be in compliance with the frequency that you need to be scheduling them, given that you set up the procedure as quarterly. If you're doing it every 3 months and every 6 months, then you're just doing redundant work. So every 6 months, you're gonna have 2 work orders that generate, one with the quarter, one with the 6 months. And then if you want to kind of drill into those and start to ask, if I want to see what are these 11 assets here that are, you know, kind of scheduled incorrectly with their frequencies. I can always drill into this, get their asset numbers, go into the CMS tool and just make sure that those schedules get updated appropriately. And so those are the kind of things that just from a data quality perspective can help tell you that, you know, hey, the work set that we're about to get into, the labor that's being logged and the work orders that have been created are not redundant and they are also complete. There are other reports that kind of can do similar things for you. There are things like cancellations and transfers that will just kind of show you over time, you know, across different locations and categories or however you want to break that down, you know, how many work orders are you having to cancel, either because they don't get approved or because they're redundant or they're, you know, whatever reason you might have to need to cancel a work order, or are they being transferred a lot? Are you assigning things in incorrect ways that are requiring you to transfer them to other segments or other trades? Do you need to clean up your workflows? You know, they help assess, do you have your system set up correctly? And what that allows you to do is then to get into reports like productivity, which are all focused around kind of what work you're doing and where you're doing it. And so I'll jump over to a kind of more asset focused view on this in just a second. But when you kind of land on this report, I have some bookmarks set up, so it'll take a second to apply those bookmarks, which are just basically pre-configured views. So you don't have to watch me toggle around and click through a bunch of different filters. But when you land on this report, it'll kind of give you a breakdown of, you know, in the last 30 days, the last 365 days, you know, however many, you know, whatever time period you want to look at this by, you know, how often, how much time per day are our technicians actually doing work. So, you know, if you're working an 8-hour shift, then you may expect that 6 or 6.5 hours of actual productive labor to come out of that. And that's all going to come from, again, in that CMS tool. You know, when you complete the work orders, you say, I spent 30 minutes working on this asset. And we can see here that, you know, you get breakdowns by user, breakdowns based on the different trades that are involved, breakdowns by the different locations. You know, how does that change per day? If numbers look, you know, this is maybe skewed up, then maybe it's because someone closed, like, for example, on this day, there's very, very high number of hours per day. That probably means someone closed a lot of work orders on that day and incorrectly logged their labor charges. And so again, anytime we're trying to present data, we're trying to also present ways for you to kind of sanity check that the people or the processes that produce that data did so in a way that makes sense. And then you can kind of jump into things like work nature, and you can see, you know, over time, how much of the work that we're having to do is work that we planned for, and how much of that is work that we're having to react to. And you can kind of see how that evolves over time. In our demo data, this is very sporadic, but typically these will kind of follow trends, and you might see, you know, as organization, as you implement processes to improve the amount that you're more able to proactively identify work, you'll kind of see these diverge, and maybe you'll start to see proactive work overtake reactive work. And a lot of times what we see when customers are first getting into analytics is that much more of their work is reactive than proactive. And these are the kind of tools that then first help you identify that problem, and then through all the different pages and all these different reports, give you the tools to kind of address that problem. And to kind of bring this into a capital planning scope, we have things like the failure analysis, which is very similar to what I was just looking at in terms of understanding what work you're doing and where, but it's specifically focused on assets. So, you know, by default, when we load into reports like this, we're more focused on that kind of, again, reactive work. So by default, I don't include inspection, testing, and maintenance in this data set. You might filter it down to only Pittsburgh to HTM data if that's the only segment you're working on. You might expand this and focus down only in on one particular location if you're not interested in comparing locations. But then you can start to ask questions like, you know, on average in the last 365 days, how many of these assets did we have to touch reactively? What percentage of our total asset set does that comprise? And on average, how much time are we having to spend on those assets when we do touch them? And then from there, you can kind of drill in, and you can say, you know, I'm curious about those tablet computers that we're working with, or maybe I'll stick with tablet computers just because we have a little bit of data there, but I can drill into that and I can see, you know, what is the work order history to that? Very similar to what we were looking at in the actual capital planning module itself. But then you can quickly see that, you know, these are the assets that got touched in this that are Medtronic pads. This particular iPad had 4 work orders on it, and we spent, you know, twice as much time on it than anything else. In a real scenario with real customers, you know, you'll see they might be looking at an anesthesia unit, and, you know, one particular unit may have had 35 more hours in the past 365 days than the other units, and then you can click on it and, you know, kind of quickly filter this left side. So you can, similar to in the capital planning module, see, you know, what are those? What was the work that we had to do? Again, just trying to give you an idea of, are there things that you're missing right now that aren't at the top of your mind that you need to be paying attention to and that you need to be addressing? There are other things in here. Joe mentioned like resourcing, you know, being understaffed is a very common issue in hospitals, whether you're in facilities or in HTM, and combining things like productivity to understand how much work a typical technician can do in a day with something like resource planning to help you understand how much work is coming in on a given day can help you, you know, get a good idea and make a good justification when you're making budget requests and things like that for, you know, I'll bring this back so we have more data. Let's do 12 months. To be able to say that, you know, hey, we have this much work coming in on average on any given hour of the day or any given day of the week. Right now, we only have this much available labor to accomplish this. And so, you know, we need 1 or 2 more, 3 more technicians. And it gives you an idea of just, you know, what beyond just knowing that you need more technicians, because everyone knows they need more technicians, but giving you an idea of exactly how many more technicians do you need. And you can kind of, you know, combine that with things like backlog. Like ideally, if you're perfectly staffed, you're going to have a backlog that is very stable, but you can look at reports like this and see that, you know, quickly, is our backlog trending upwards? Does that mean we're understaffed? You know, it's growing over time. We're not addressing all of our work. Or if it's somehow trending downwards, maybe you're actually overstaffed and maybe there's more work that you can be doing. Maybe you can be doing more thorough inspections on certain assets, maybe outside of compliance reasons. You know, and all of that's just, it's meant to be the purpose of this kind of reporting effort and doing that collection and planning and modeling and report delivery is so that, you know, you don't need to be a data engineer or an expert in the CMMS tool itself to be able to identify these issues. So if you're a manager, you can look at these things and intuitively understand that, you know, we have a problem, or here's an area that we can improve, or here's a place where maybe we're doing work that is redundant that we don't have to do. I know I'm coming up on time and there's a few other things I want to show outside of the demo. So I'm going to hand it back over to Joe. There's a bunch of other things that I could show in here, but we'd need 2 hours to show that. So I'm going to hand this over to Joe so we can get into kind of, you know, the why of this and maybe what's coming, what the next steps after you get past reporting are.
All right, thanks, Justin. And you know, and as you're looking at that screen, you can see we have different departments opened up. You know, HTM, IT, you know, some other things there. And you know, that's just for our demo environment. Typically, you know, with a customer that has, you know, 10 hospitals, 20 hospitals, 100 hospitals in their system, they're actually comparing operations of hospital to hospital. So I just wanted to point that out as well. Like our demo environment wasn't just facilities versus HTM versus IT versus university. You know, we have, you know, think of like if you have, you're in a city and you have the North Campus, the East Campus, the West Campus, and the South Campus, and maybe the Central Campus. Those graphs are going to show how each one's performing against each other. And you can really do internal benchmarking amongst yourselves of, you know, hey, why is it taking this department this much time to do this type of device and this other hospital is doing it in half the time? Are they doing it right? Are they doing it wrong? You know, those are some things that really help raise questions in that. But so I just wanted to sort of give that some context before I pass it back to Justin here and talk about the next slide here.
Yeah, very, very good shout. Thank you for that.
Yep.
And so then the why, you know, I keep talking about all these different things and I showed all these different things that would say, you know, maybe you'd identify this thing or maybe you'd identify that and all these hypotheticals. But the real reason you're doing that is because there is, unless you're already running a perfectly efficient system, there are areas that you can improve, full stop. That's just not a subjective statement, it is an objective statement. And this is a real testimonial that we had from right when we first kind of went into this reporting effort very early on, and we were kind of building out just a few of these reports. And one of the customers that we were working with to actually build out those kind of proof of concepts realized that they had essentially things just very, very overscheduled. And there were redundant schedules, and there were things that were scheduled for 1 month when they could have been quarterly. And just by doing a kind of large scale kind of scheduling reprioritization, and then looking at things like productivity to see how much actual time they were saving, they ended up making the estimates they were saving $30,000 a month in labor across their facility just by rescheduling their assets. And so that's where this kind of value comes in. And there's, that was a relatively small hospital. We have some hospitals that are, 30 campuses, big HMOs that, we should do a similar case study with them because it's probably in the hundreds of thousands, if not millions. But that value is there and you're creating the data either way. So without reporting, you're just kind of leaving that value on the table from that data that you create.
Let's talk a little bit about the future.
Oh yeah, sorry, I didn't mean to cut you off.
Go ahead.
But so what's next? So, data visualization and this kind of analytics, this aggregational and trend reporting is not necessarily new. That's things that, have been done and they've been improved upon, and hardware is improved and techniques have improved to where you can do it at a much bigger scale than you used to. But for the most part, that kind of trend analysis and, aggregational reporting hasn't changed that much in the last, 10, 20 years. And now with the kind of evolution of LLMs, I know a lot of people, to some people, AI is a crazy, exciting new thing. To other people, it's repulsive. But with LLMs, we're not thinking that these will replace the data engineers that do visualization or the, people that are running these. You're not going to say, AI, tell me how to improve my hospital, but it will give a lot more control to those who maybe aren't skilled data engineers or aren't advanced technical users to be able to say, I have this additional question that's a small question, and instead of needing to go build out a new model and build out new reports or run an Excel spreadsheet on 500 rows worth of data, I can leverage the fact that we have LLMs that can help us query this data to give me quick answers to those questions. And beyond the kind of analytical side of things, imagine a world where instead of, you're a technician doing rounds and you realize that there's something that needs a work order now, and you submit a technician request to replace an asset or repair an asset. And instead of having to go onto an iPad and fill out a whole form, you can leverage the location data and the images, the camera on that iPad to take a picture and then say, hey, CMS, create a work order to repair this asset. And then that LLM can kind of interpret what you're saying and realize, hey, okay, I need to do this. I need to fill out this data based on location it's here, et cetera, and you have a work order there in seconds as opposed to, the 3 or 4 minutes that it might take you to fill out a full complete form with notes and everything else. And so those are the kind of things that we're looking to do next to kind of continue improving on this kind of holistic data structure that we're building. And that's, what comes after that, we'll have to see. We'll have to see how this part turns out.
And AI will have to tell us what's next, right?
Yeah, I guess we'll have to ask.
All right, and that brings us to the Q&A portion of the session. So that's the prepared stuff. So let's see what kind of questions you guys have.
Okay, we got a few that come in, Joe. The first one is, how does analytics or capital planning handle multi-department collaboration if HTM needs to align with other operations?
All right, I'll take the capital planning portion of that. Right now it's set up for individual department planning, but we have some planned enhancements to do global capital planning across the entire organization. So that's where the capital planning is going. But analytics, I think we saw some of that in analytics as well. When we were doing some of the filters, we were filtering specifically to the HTM department, but some of the graphs Justin showed did show, different departments as well. But Justin, if you want to expand on that a little bit for analytics.
Yeah, there's kind of two components of that. There's the benchmarking and comparisons against departments and locations, or, against teams if you have teams set up. But there's also the component of actually collaborating between those teams and collaborating between individuals. And a lot of that's kind of made possible through analytics. One, by just giving you the kind of visuals that let you ask questions and let you, show something to someone else and say, what do you think about this? Why do you think this is happening? Let's discuss. But also within all of those reports, and something I didn't really show, we leverage a kind of setup that allows you to say, I've applied all these filters in this date range and this XYZ, and you can save that as a bookmark or as a view, and then you can just share that with another person. And so then when they click on that link, they see the exact view and the exact setup you were looking at, and then they can kind of adjust it and tweak it and ask their own questions. And so collaboration is one of the things that we think about a lot when we're designing these kind of tools.
Yeah, and something we're looking at too, just to talk about what's next, and incorporate that into the question is, benchmarking against other hospitals. What's another, if you have a 300,000 square foot hospital, how are you doing in comparison to that 300,000 square foot hospital across town or across the country? You know, what are their resource levels? How are they performing on their work nature ratio of PMs to non-PMs? So those are some things we're looking at as well. That would take an industry-wide standardization, which is something we're working at and we're passionate about, but it takes, you know, all the hospitals to adopt that. But that's something we're working towards as well. But it's really cool to see that type of information too. So.
Okay, great. Another question here is, can the system integrate with other tools to keep the data synced?
So with other tools to keep the data synced, you know, analytics is, you know, mostly in the CMMS as we're showing it, but we are getting some external data for things like, and I'll let Justin talk a little bit about this, for things like energy management or hours worked from a timekeeping software. So those are some things we can interface to as well. But I know, Justin, you did some things with energy bills with a particular customer. So.
Yeah, so typically the way that we kind of handle those things is we still let kind of CMS be the kind of source of truth, at least as far as we treat it for the data, but that doesn't mean that we can't integrate things into CMS. Like, for example, Joe mentioned utility data. Some other examples are, you know, their space and, you know, building information management systems, like, you know, what buildings you have, what are their models, what are their square footages, and being able to link assets to that. And we work to integrate some of those tools in, like Archibus, for example, into CMS. Joe mentioned timekeeping, like Kronos, softwares like that. So there are a lot of different tools that there are already integrations that exist into CMS, and we can kind of feed that data into analytics. Or, you know, if the integrations don't exist, then I'm sure they will exist at some point.
Yeah, and you know, another thing, just with testing devices, you know, and a lot of HTM departments use testing devices. You know, I go back to the MedTester 5000 days, so there's probably some fans on here about that. But that data ultimately goes into the CMMS and marks a device as passed or failed, which all that stuff feeds into the analytics and into the capital planning module. So if the CMMS is integrating with it, we're probably storing that as historical data in the CMMS. But that's just one other area we could integrate with as well. So.
Great. So can the tools help identify underutilized or redundant assets that could be repurposed or decommissioned?
Underutilized assets. That's a good question. I'm trying to think of an answer to that one, because the requirements are to test the devices. I'm not sure if we're tracking usage data at the department level of when that is in service. But that could be easily done with a status change on the equipment. If a status, you know, if you're tracking assets that are in use on a patient, that might help you actually trying to locate equipment if you're trying to find it and where it was last used. You know, if you update some of that information. But if there's equipment just in storage, or that one, you know, that one nurse hides stuff in the closet, so she always has one as a backup. Whatever the reason may be, we're only tracking the maintenance history of that equipment, so not necessarily the usage of that equipment, at least in the HTM world that I could think of. But Justin, I don't know if you have another answer on that one that expands on that more.
Yeah, no, pretty similar to your answer. There are maybe like proxies that you could find in the data. Like, for example, if an asset's very frequently closed with, you know, a status, if you set up statuses with unable to locate and you're completing work orders on that asset, and, you know, the completion of that work order is saying that, you know, it couldn't be found, and it's something that, you know, should be easily found, then it may be some, if it's consistently unable to be found, then maybe it's, you know, not in use, or maybe if there's never any repairs on it, you could maybe do an inverse analysis of too much repair and do too little. But I agree. I don't think we're doing anything really with utilization at the moment. But you'd have to define kind of for those assets, what does utilization look like and how do we capture that? And then from there, it's the same plan, collect, model, deliver that we did with the maintenance history. So
I would love to see the process of how you're tracking that information, though. So feel free to reach out and follow up on that one if you want. I'm curious. It's for my own curiosity.
Okay, another question that's come in. What's your recommendation for building a plan for items that may not have individual asset records, i.e. mass replacement of med gas cylinder carts?
Joe, how would y'all typically handle that in CMS? Because that'd be
Yeah, for capital type things or larger system type things, typically there's not assets for that. Sometimes you put those in as far as the building's concerned. For that type of equipment, we do have, I know ASHE for healthcare engineering, the American Society for Healthcare Engineers, publishes a list of standardized categories, and some of those building structures and larger type infrastructure devices are in that asset category list published by ASHE. We do recommend tracking those as assets if there's going to be something you are going to replace or do work on or track. You could also do those as locations or location-based devices. But as far as the replacement of that capital expenditure, that's where the maintenance, the graph that was on the right when I was showing the capital planning, since the categories exist, you could add those into the capital plan for those areas. But unless you're tracking work done on those things, you're not going to have that historical data. But if your building's 50 years old, those are things you're just going to have to know to add those to the plan. But if you're not actively doing work on those items in the CMMS, you're not going to have that historical data. So my recommendation is know your buildings, but track work on those items as well. So
that's very similar to what I was going to say. And there are I should say FSI in particular does work with customers to help, collect their assets and kind of translate some of that knowledge from, the intuitive knowledge of the people that have been there for 50 years to, now you have an asset collection that might include those things that you can track it. So it's not something that you necessarily have to do on your own.
Okay, perfect. I've got a few other questions which I will forward to you afterwards as we're coming up to our hour. So thank you both for such a great and informative demo today. I'd like to encourage everyone to visit today's sponsor's website, fsiservices.com, to find out more about their products. Now, as promised, the answer to today's trivia question is Wisconsin. So congratulations to our winner, Michael Lucas, in Indiana. And just a quick reminder, you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. Now, you must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. Now, if you have any questions, you can reach us at webinar@mdpublishing.com. Now, if you've missed any of our past tools of the trade demos, including any by FSI, please visit webinarwednesday.live to view our whole archive. We'll be back next month with another Tools of the Trade live demo. So please visit webinarwednesday.live for more details and complimentary registration. So thank you once again for your time today, and I hope you all enjoy the rest of your day.
And thanks so much for having us.